Taking a look at some of the very latest numbers this morning from the CDC, roughly 1 out of every 36 children has now been identified with autism spectrum disorder.
So joining us, we have Colleen Allen from the Autism Alliance of Michigan. Thanks a lot for coming in this morning.
Thank you.
So autism, it has such a wide meaning. When people say autism, what do you want people to think of?
Well, I think what's most important is to think about autism on the spectrum. You know, we really have moved away from the classic definition of autism defined by children and adults with the most severe symptoms, those that are more moderately affected, and of course those that are high ability, or what we used to call high functioning. So just know that when you meet a person with autism, you've met one person with autism. It's a common phrase we use, because you may meet an engineer with multiple degrees, but still struggles in getting a job and keeping a job, in the same way that a person on the spectrum can require full-time care, never speak. So there's varying degrees of severity that you see, and so it's really important to know that as we raise awareness about autism over the course of this month, and thinking about how you communicate, socialize, and interact with a person.
I saw you nodding there when we were talking about the CDC numbers, 1 out of every 36. Are we just doing a better job of testing, do you think, at this point, or why are the numbers looking like that?
It's definitely related to increased identification, earlier identification. So if you think about the fact that we're diagnosing children at the age of 2 and 3, you're adding that segment of the population to your numbers. So we have better diagnostic tools, the increased awareness of even the general population and parents recognizing when a child isn't making eye contact or producing their first words before the age of 2. Those are real concerns. We still have a long way to go, though, in terms of our physicians, our early child care workers, recognizing those symptoms and actually acting on them, and not explaining it away as, oh, you're just a delayed talker, you know, or it's personality. It's, you know, my child is shy, that's why they're not talking or engaging with other children. So really taking those concerns seriously is some of the work that we're trying to do as an organization.
Yeah, your organization, the Autism Alliance of Michigan. Tell us a little bit more about what exactly you do.
Sure. So we are a statewide professional organization. Much of our work falls into the advocacy realm. Our flagship program is connecting families to support services through professional guidance. You know, it's really the hand-holding that comes with the earliest diagnosis, you know, when a family is first faced with some of the challenges with where do I go, what do I expect, all the way up, you know, to adult service needs. We've got lots of adults who are either being diagnosed at a much later age or don't really understand the service system and are really struggling to find a job or housing, for example. You know, we've got lots of challenges around adult services, and more so than children.
Well, what does Autism Awareness Month actually mean? I mean, we hear it, you know, the phrase kind of tossed around, and what do you hope to accomplish?
So we really have sort of expanded our thinking around April so that we now talk about autism awareness and acceptance, because great strides have been made in terms of understanding and autism across the spectrum. What we really, and what I would like to message to the general public is it's about inclusion. You know, the efforts to include people with autism in our community, at our parks, at our zoos, at our museums, in our educational facilities, in our employment opportunities. And so the acceptance piece is really critical for us going forward, and what we really want to help people understand. And we do a lot of educating around what it is. You know, we have first responder training, recognizing those early behaviors, you know, in an encounter, so that a police officer knows how to safely and comfortably interact with a person who may be behind the wheel, or a child that wandered from home. That we really are getting better as a community.
And quickly, where can people go if they want to get involved, you know, especially in this month?
Autism Alliance of Michigan.org is our website. There's lots of great resources there. We are having our gala this Saturday, which is our annual event to really celebrate progress and again raise awareness about what others should know in terms of autism and community support.
We are learning so much about autism. Colleen, thanks a lot for dropping by this morning.
Thank you.
Absolutely. Thank you for having me.